Bismillahirrahmanirrahim. Growth hormone decreases carbohydrate utilization. Growth hormone has multiple effects on carbohydrate metabolism, including decreased glucose uptake, decreased glucose uptake into skeletal muscles and fats, decrease and increase glucose production by the liver, and increase insulin production secretion. Each of these changes result from growth hormone induced insulin resistance, which attenuates insulin action. Which attenuates insulin action to stimulate uptake and utilization of glucose and skeletal muscle adipose tissue to inhibit gluconeogenesis by the liver. This leads to increased production of glucose and a compensatory increase in insulin secretion. For this reason, growth hormone effects are diabetogenic. Excess secretion of growth hormone promote multiple metabolic disorders. Multiple effects. Multiple effects. Multiple effects. Bismillahirrahmanirrahim. Multiple effects. Number 2, growth. Multiple effects. Decreased glucose uptake in tissues such as skeletal muscle. Multiple effects. Decreased glucose uptake in skeletal muscle. Increased glucose production by the liver. Increased insulin secretion. Multiple effects. Decreased glucose uptake. Multiple effects: decreased glucose uptake, increased glucose production by the liver, and increased insulin secretion. Insulin resistance. Increase attenuates insulin actions to stimulate to utilize uptake and utilization of glucose in skeletal muscle and adipose tissue, and to inhibit gluconeogenesis by the liver. This leads to increased glucose production by the liver. This leads to increased blood glucose concentration and a capacity increase in insulin secretion. For this reason, growth hormone effects are diabetogenic. Excessive secretion of growth hormone can promote metabolic disturbance similar to those found in patients with type 2 diabetes. Insulin mellitus. Growth hormone decreases carbohydrate utilization. Growth hormone has multiple effects on carbohydrate metabolism, and decrease carbohydrate utilization, decrease carbohydrate uptake from the skeletal muscles and fats. Increase glucose production by the liver, and increase in insulin production. All of these changes result from insulin resistance. Result from insulin resistance, and then there will be insulin resistance. These changes result from insulin resistance. Result from insulin resistance, and Bismillahirrahmanirrahim, result from insulin resistance, and to inhibit insulin uptake, attenuates insulin action to stimulate which attenuates insulin action to stimulate uptake and utilization of glucose in skeletal muscle. Insulin action to stimulate uptake and utilization of stimulate uptake and Insulin action, which attenuates insulin action to release. Um, which attenuates insulin action to stimulate uptake and utilization of glucose in the body, and to inhibit the and to inhibit glucose production, and to inhibit glucose production by the liver gluconeogenesis. The effects are diabetogenic, and compensate increase in insulin resistance, insulin production, diabetogenic metabolic disorder, and can produce metabolic disturbance similar to those found in diabetes type 2. Which are also resistant to the metabolic effects of insulin, which are also resistant to the metabolic effects of insulin, which are also resistant to the metabolic effects of insulin, which are also diabetes insipidus, diabetes mellitus, similar to those found in patients with type 2 and non-insulin dependent diabetes mellitus, who are resistant to metabolic effects of who are resistant to metabolic similar to those who are resistant to metabolic effect of insulin, who are patients with acromegaly who have excess growth hormone secretion. Patients with acromegaly who have excess growth hormone secretion are usually lean with little visceral fat. Very little visceral fat, whereas patients with type 2 diabetes are frequently overweight with excessive visceral fat, which derives insulin resistance. Visceral fat. Bismillah Rahman Rahim. It will be this problems with the growth hormone secretion will be similar to those found in will be similar to the problem with growth hormone secretion will be similar to those found in in type 2 diabetes mellitus, which are type 2 diabetes mellitus, type 2 diabetes who are resistant to metabolic effects of who are resistant to metabolic effects of who are resistant to metabolic effect of insulin, or patients with acromegaly with larger amount of patients with acromegaly with a larger amount of patients with acromegaly who have greater amounts of acromegaly who have excessive growth hormone are usually lean with less fat, but with type 2 diabetes have excessive fat and within visceral fat which drives insulin resistance. We do not know the precise mechanism by which growth hormone causes insulin resistance and decreased glucose utilization by the cell, and decreased glucose utilization by the cell. mm, We do not know the precise mechanism by which growth hormone causes insulin resistance, which are also resistant to metabolic effect of insulin. Growth hormone causes insulin resistance and decreased glucose utilization. But decreased glucose utilization, our growth hormone induced increase in our growth hormone induced increases growth hormone. However, growth hormone induced increases. mm, mm, However, growth hormone induced increases in lipolysis and blood concentration of fatty. However, growth hormone induced increases in growth hormone induced increases in lipolysis and blood concentration of fatty acids likely to contribute to the impairment of insulin action on the tissue glucose utilization. However, GH induced increases growth hormone induced increases in lipolysis increases in growth hormone induced increases in lipolysis and blood concentrations of fatty acid likely contribute to impairment of insulin action on tissue glucose utilization. However, growth hormone induced increases in lipolysis and blood concentration of fatty acids likely contribute to the impairment of insulin action on tissue glucose utilization. However, blood concentration of fatty acid and blood concentration of fatty acid likely contribute to impairment of insulin action on tissue glucose utilization. Experimental studies indicate that rising blood level of fatty acid above normal rapidly decreases the sensitivity of the liver and skeletal muscle to insulin effects on carbohydrate sensitivity of the liver and skeletal muscle to insulin effect on carbohydrate metabolism. Bismillahirrahmanirrahim. And we discussed that in acromegaly there will be less weight with greater height and excessive hormone, and type 2 diabetes will have greater hormone and greater fat. And we do not know the precise mechanism by which growth hormone causes insulin resistance and decrease glucose utilization by the cell. Growth hormone will cause insulin resistance and decrease glucose utilization. Growth induced increases in lipolysis and blood concentration of the fatty acid likely contribute to the impairment of insulin action on tissue glucose experimental studies indicate that raising the blood levels of fatty acid above normal decreases the sensitivity of the liver and skeletal muscle to insulin effects on the carbohydrate metabolism. So growth GH induced increases in lipolysis and blood concentrations of fatty acids. GH induced increases in lipolysis and blood concentration of fatty acids likely contribute to the impairment of insulin action on tissue glucose utilization. Experimental studies indicate that raising the blood levels of fatty acid above normal rapidly decreases the sensitivity of the liver and skeletal muscle to insulin effects on carbohydrate metabolism. Now, what we discussed that growth hormone decreases carbohydrate utilization. Growth hormone has multiple metabolic effects on carbohydrate metabolism. It decreases the glucose utilization. It decreases glucose uptake in tissues such as skeletal muscle and other tissues. Glucose utilization, glucose uptake, decreased glucose uptake in tissues such as skeletal muscle, increased glucose production by the liver, and increased insulin secretion. Each of these changes result from insulin resistance. which attenuates insulin action to stimulate uptake and utilization of glucose and to inhibit gluconeogenesis, glucose production by the liver. This leads to increased glucose. Mm, Bismillahirrahmanirrahim. So what we study, the growth hormone, it decreases. Growth hormone decreases due to decreases carbohydrate utilization. Multiple effects on carbohydrate. Decreases carbohydrate uptake by the liver and others, by skeletal muscles and other cells, and increases fat. Increases fat and increases insulin production. And third, increase insulin production, increase glucose production by the liver, liver insulin resistance. All of these points result from the insulin resistance. All of these points result from insulin resistance. Glucose are which attenuates insulin action to which attenuates insulin action to stimulate uptake and utilization of glucose in skeletal muscle and adipose tissue, and to inhibit gluconeogenesis, glucose production by the liver, similar to diabetogenic excess secretion of growth hormone can produce metabolic effects similar to those found in type 2 diabetes. Who are also resistant to the metabolic effects of insulin are patients with acromegaly and type 2 diabetes. So what we studied is, first of all, is multiple effects. Decreased glucose uptake in skeletal muscles and fat tissues, and increase third point, increase insulin production, and increase glucose production by the liver. Each of these changes result from growth hormone induced. Each of these changes result from growth hormone insulin resistance, which attenuates insulin action to stimulate uptake and utilization of glucose in skeletal muscle and adipose tissue, and to inhibit gluconeogenesis by the liver, and this leads to increased blood glucose concentration and a compensatory increase in insulin secretion. For these reasons, the growth hormone effects are excess production, um, excess secretion of growth hormone. Secretion of growth hormone can produce metabolic Bismillahirrahmanirrahim. Growth. So we are going to discuss about growth hormone decreases carbohydrate utilization. Growth hormone has multiple. mm, we are going to discuss that growth hormone decreases carbohydrate utilization. Growth hormone decreases carbohydrate utilization. Growth hormone has multiple metabolic effects that influence growth hormone has multiple metabolic effects that influence carbohydrate metabolism. Decrease glucose uptake by the cell and increase insulin secretion and increase production of glucose growth production by the liver. In each of these changes result from the growth induced insulin growth hormone induced increased resistance in insulin resistance, which attenuates insulin action to stimulate uptake. Each of these changes result from growth or each of these changes result from growth hormone induced insulin resistance, which is insulin action to stimulate the uptake and utilization of glucose in a skeletal muscle and adipose tissue, and to inhibit gluconeogenesis, glucose production. This leads to increased glucose production and capacity. mm, which attenuates insulin action to stimulate utilize to stimulate uptake and utilization of glucose in skeletal muscle and adipose tissue, and to inhibit gluconeogenesis. Gluconeogenesis is production by the liver. This leads to glucose production and capacity limit.